I also wanted to really quickly go through our spring 2024 ICARE newsletter, which we just released a few days ago. So in this newsletter, which is available on our website, we've gone through some NCCN guideline updates that were released within the last few months. One of them is looking at the risk of contralateral breast cancers across various genes, which we highlighted in the newsletter. The other thing was we really expanded out guidelines regarding hormone replacement therapy following risk-reducing self-lingual oophorectomy in BRCA carriers. And again, highlighting that HRT is not a contraindication, which we know there are some misconceptions out there, especially in the absence of breast cancer. So there are some very detailed updates to that section, which I am very excited about. We also highlighted some of the other guidelines that have come out, notably ASCO and the Society of Surgical Oncology set forth some guidelines about germline testing in patients with breast cancer. And then we highlighted some articles looking at refinement in cancer risk. Again, I have on the bottom panel some of the social media posts that we've done about these articles as well. So those are available on our website as well as our social media feeds. Treatment updates, as always, we also included. And then my colleague, Dr. Alvarez, who's the head of OB-GYN and a gynecologic oncologist at Vanderbilt, addressed a question about HRT in a BRCA carrier following bilateral oophorectomy or preventive oophorectomy. And again, highlighting what the data is and why this is something that should be considered. And Dr. Alvarez is also the vice chair of the NCCN ovarian cancer treatment guidelines. And then, as we've already looked at with some of the other slides, we have a robust social media presence across various platforms. So if of interest, please follow us on your platform of choice.